This medication is administered through a slow injection into a vein by a healthcare professional, as directed by your doctor. Usually, it is given every 4 weeks for a total of 6 injections. The dosage of Xofigo is determined based on your medical condition, weight, lab tests, and how you respond to the treatment. To prevent dehydration, it's important to drink plenty of fluids while undergoing treatment with this drug. If you have any questions, be sure to consult your doctor or pharmacist. Since this medication releases some radiation and may be present in your blood, urine, or stool for about 1 week after an injection, it's important to avoid contact with these bodily fluids during that time. To prevent splashing, it's recommended to sit down on the toilet seat each time you use the bathroom during the 1-week period after your injection, and flush the toilet twice afterward. Afterward, wash your hands thoroughly with soap and water. Use medical gowns and gloves if you need to clean up any blood, urine, or stool. If any of these bodily fluids get on your clothing, be sure to wash the clothing right away and separately from your other clothing. Some common side effects of Xofigo 1100 kbq/ml, 30 microcurie/ml, intravenous solution include nausea, diarrhea, and vomiting. If these effects persist or worsen, it's important to notify your doctor or pharmacist. Dehydration is also a potential risk, especially if you experience ongoing vomiting or diarrhea and are unable to drink normally. Contact your doctor immediately if you notice symptoms of dehydration such as an unusually dry mouth, increased thirst, rapid heartbeat, or dizziness. While there are potential serious side effects associated with this medication, your doctor has determined that the benefits outweigh the risks. It's important to be closely monitored by your doctor to minimize your risk. Contact your doctor right away if you experience serious side effects such as easy bruising or bleeding, signs of kidney damage, or bone pain. Xofigo 1100 kbq/ml, 30 microcurie/ml, intravenous solution may also lower your ability to fight infections, making you more susceptible to serious infections. Notify your doctor if you experience signs of infection such as a persistent sore throat, fever, chills, or cough. While rare, a serious allergic reaction to this medication is possible. Seek immediate medical attention if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not mentioned. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Xofigo 1100 kbq/ml, 30 microcurie/ml, intravenous solution, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions or other issues. It's important to also discuss your medical history with your doctor or pharmacist before using this medication. Xofigo 1100 kbq/ml, 30 microcurie/ml, intravenous solution may increase your risk of getting infections or make existing infections worse. It's best to avoid contact with anyone who has an infection that could easily spread, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to talk to your doctor for more details. Before receiving any immunizations or vaccinations, be sure to inform your healthcare professional that you are using Xofigo 1100 kbq/ml, 30 microcurie/ml, intravenous solution. It's also important to avoid contact with individuals who have recently received live vaccines, such as the flu vaccine that is inhaled through the nose. To reduce the risk of getting cut, bruised, or injured, use caution when handling sharp objects like razors and nail cutters, and avoid activities like contact sports. Xofigo 1100 kbq/ml, 30 microcurie/ml, intravenous solution may also increase your risk for other cancers, such as bone cancers. It's essential to talk to your doctor for more details. This medication is not recommended for use by women. For males with female partners of childbearing age, it's important to inquire about reliable forms of birth control while using this medication and for 6 months after stopping treatment. Female partners should also use reliable forms of birth control for the same amount of time. It is currently unknown if Xofigo 1100 kbq/ml, 30 microcurie/ml, intravenous solution affects sperm. If you plan to father a child, it's crucial to discuss the risks and benefits of this medication with your doctor. When taking Xofigo 1100 kbq/ml, 30 microcurie/ml, intravenous solution, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Xofigo is abiraterone. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If someone takes too much Xofigo and has severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they can contact their local poison control center for assistance. U.S. residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. During your treatment with Xofigo, your doctor may need to perform lab and medical tests to monitor your blood counts and kidney function. It is important to attend all scheduled appointments for these tests. Be sure to take each dose of Xofigo as directed by your healthcare provider. If you happen to miss a dose, consult with your doctor or pharmacist to determine a new dosing schedule. This medication is administered in a medical setting and will not be kept at home for storage. It is important to follow the instructions of your healthcare provider regarding the use of Xofigo 1100 kbq/ml, 30 microcurie/ml, intravenous solution. This medication is used to treat prostate cancer that has spread to the bones. It is given as an intravenous infusion once every 4 weeks for a total of 6 doses. The optimal timing for taking this medication will be determined by your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.